The biggest results that we have achieved in Mongolia is first by ensuring the access to quality reproductive health services. Mongolia has become one of the only 9 countries in the entire world which has achieved the maternal mortality target in 2015. And we have put in place the innovative mechanisms of telemedicine network for maternal and child health. That really helped the pregnant woman living in remote areas to access quality reproductive health services. So that's number one. The second achievement is that we have helped the government to develop and then approve the gender equality law. So the gender progress in Mongolia has been very impressive, and of course still there is a lot more to be done, especially in the area of gender-based violence. But in terms of advancing women's opportunities and status in society, Mongolia has achieved a lot, and the UNFPA was part and parcel of that process. Especially in the Asian and Pacific region, we have a number of middle-income countries. UNFPA has done a very good work and then produced a lot of results in the area of sexual and reproductive health and then in achieving ICPD targets. But then at the same time, we have learned that in those middle-income countries, and especially in resource-based middle-income countries in the region, we have seen the fragility and the vulnerability of those countries. And in some instances, we have seen the reversal of the developmental gains that we have achieved thus far. So in the new strategic plan, I would like to really see the big part in UNFPA's strategic approach to middle-income countries, so that we not only stop that reversal of the developmental gains, but then also progress further to achieve ICPD goals. In that vein, UNFPA's support for policy and advocacy, and also communication with the public in making sure that the public is also very much aware of sexual and reproductive health and rights issues, that becomes a very important part. And the UNFPA can play a role in creating that national movement towards ICPD and people's recognition, and providing the enabling environment to allow the universal access to sexual and reproductive health services and quality services. I think that's an important part for UNFPA to play in coming years.